Dear pharmacy students, welcome. Today we're going to tackle a topic that is absolutely central to everything we do in pharmaceutical sciences: inflammation. Now, I know you hear this word all the time. We often think of it as the bad guy, right? Something we need to fight with a pill. But what if I told you it's actually one of the body's oldest and most brilliant defense systems? So let's dive deep into this process and understand what's really happening when your body sounds the alarm. Just imagine this. We've all been there. You get a tiny little splinter, maybe a paper cut, and almost immediately, your body launches this full-scale emergency response. You see that redness, you feel the heat, the swelling, the pain. But listen, that's not the problem itself. No, that is the solution in action. It's the clear sign that your body's internal first responders are on the scene and already hard at work. So before we get into the nitty-gritty, let's just reframe our thinking. Inflammation isn't the villain. At its core, it's a protector. It's a powerful, intelligent system whose main job is to defend you from harm and, just as importantly, to kickstart the entire healing process. So here's the formal definition, which you should definitely know. Think of inflammation not as a symptom, but as a mission, a biological special ops mission. The second there's a breach, like that splinter, the mission begins, and the objectives are crystal clear. First, eliminate the threat. Second, clear out all the damaged cells and debris. And third, immediately begin the process of reconstruction and repair. Now, this internal battle is not a silent one. Oh no. It sends out very clear signals that we can see and feel right on the surface. These are so fundamental to medicine, they were actually described thousands of years ago. We call them the cardinal signs of inflammation. And this part is very, very important for your exams. So, here they are. The 5 classic signs. Let's break them down. The redness, or rubor, and the heat, calor, that's simply from increased blood rushing to the area, bringing in the troops and supplies. The swelling, or tumor, well, that's from fluid leaking into the tissue, carrying all those important defensive cells. Then there's pain, or dolor. Pain is a crucial alarm system, basically yelling at you, hey, protect this area, don't use it. And finally, that leads to loss of function, or functialesa, which is the body's smart way of forcing you to rest the injured part so it can heal properly. Okay, so we've seen the signals on the outside. Now let's put on our microscopic goggles and see what's really happening inside, at the cellular level. And let me tell you, this is not chaos. It's a beautifully coordinated, precision-guided response. The whole thing follows this logical 5-step plan. First up, recognition. Special cells act like sentinels to identify the invader. Next, recruitment. A chemical SOS is sent out calling leukocytes, our white blood cell soldiers, to the battlefield. Then comes removal. These soldier cells arrive and literally eat the invaders and debris. That process, you'll remember, is called phagocytosis. Crucially, the 4th step is regulation. The body has checks and balances to make sure this response doesn't go on for too long. And finally, once the coast is clear, we move to resolution, which is the beginning of healing. So how is all of this communication happening? It's through chemical messengers, or mediators. And for us in pharmacy, this is where it gets really interesting. Look at this table. You have histamine, which is like the initial alarm bell. It opens up blood vessels. You have prostaglandins, which are responsible for pain and fever. And right there, that's the connection to our job. When a patient takes an aspirin or ibuprofen, those drugs work by blocking these prostaglandins. See the link? And then you have cytokines, which are like the field commanders, directing all the other immune cells. Right, so once the battle is won and the enemy is gone, the mission shifts. We move from defense to reconstruction. It's time to heal the damage left behind.
Before we continue with these tissue repair mechanisms, just a quick pause. If you're finding this lecture helpful, please take a moment to subscribe to our PharmaEd channel, hit that like button, and share this video with your classmates. Your support really helps us create more quality content for pharmacy students just like you. Okay, let's get back to it.
The healing process itself happens in 3 distinct phases. Think of it like a 3-act play. Act 1 is the inflammatory phase we've been discussing, the big cleanup. Act 2 is the proliferative phase. Here, the body starts rapidly building a framework of new tissue and blood vessels to fill the gap. And the final act is the remodeling phase. This can take weeks or even months as the body strengthens that new tissue with collagen, making the scars strong and durable. Now, not all wounds heal the same way. There are 2 main types. On the one hand, you have healing by primary intention. Think of a clean surgical cut, where the surgeon brings the edges neatly together with stitches. The gap is small, so healing is quick, and the scar is minimal. On the other hand, What if you have a large open wound, like a severe burn or a non-healing ulcer? The edges are far apart. Here, the body has a much bigger job. It has to fill that large gap from the bottom up. This is secondary intention, and it takes longer and results in a much more significant scar. Okay, so far, inflammation has been the hero of our story, right? The protector, the healer. But what happens when the hero just refuses to leave the stage after the show is over? This is where we see the dark side of inflammation. And this brings us to probably the single most important concept in this whole topic, the difference between acute and chronic inflammation. Acute inflammation is a sprint. It's fast, it's powerful, it does its job, and then it's over. The goal is healing. But chronic inflammation, that's a marathon that just never, ever ends. The immune cells involved are different, and instead of healing, this persistent response starts to damage the body's own healthy tissues, leading to destruction and scarring. So what does this out-of-control marathon look like clinically? Well, it's the driving force behind so many major diseases you'll see in your practice. It's the constant, painful attack on the joints in rheumatoid arthritis. It's the hypersensitive, always-on response in the airways of an asthma patient. This is what happens when our protector turns into a saboteur, causing long-term damage. Understanding this is key to understanding the pathology of many chronic conditions. This quote here sums it up perfectly. Inflammation truly is a double-edged sword. On one side, it is absolutely essential for our survival. Without it, even a small infection could be fatal. But on the other side, when it loses control and becomes chronic, it becomes a powerful engine for disease. So that leaves us with the final question. Is inflammation our friend or our foe? And the answer, of course, is that it's both. It's an incredibly powerful tool for protection and repair. But like any powerful tool, its value and its danger all comes down to one critical thing: balance. Now, I highly recommend you review the key terms we discussed and refer to your standard pathophysiology textbooks for a deeper dive. Thank you for watching PharmaEd. Keep learning, keep growing. All the best for your exams.